So here, let's go to the first illness. We're talking about fetal jaundice. So type is the fetal. Huang is yellow. Jaundice, we know the yellow color could be on the skin and on the eyes. So that's for this condition. So what's the new baby jaundice? Yeah, what's the difference with adult jaundice? So we know the jaundice that's basically is yellow skin there. And sometimes we can see on the mucosa membrane there, and especially on the white part of the eyes. That's the scaly area. So in new babies, infants. So that's the illness name we called. So basically for new baby jaundice, separate with two conditions. One condition is a physiology condition. Lot of people maybe have some natural jaundice after their birthing, but they will disappear very soon. It's not that severe kind of disorder. They will absorptions pretty fast. Another one is pathology kind of jaundice. So that truly is the illness relationship with the new baby. So that's basically including different kind of illness. So cause the jaundice basically is the level of the pigments in the blood circulations increase. So that's why we say like people have jaundice. So generally speaking, like a new baby jaundice we talked about already. One kind of type is a physiology kind of type. Another kind of type is a pathology kind of type. So then we see the difference. What's the physiology kind of type of jaundice? And what is pathology kind of type of jaundice? They both show on the skin yellow color there. So basically, the children or new baby have the jaundice 2 to 3 days after birthing. So then the jaundice show up. And like the baby is totally to the full term, like we're talking about, is about 10 months for Chinese months, 280 days. Then the baby will be maturity and then delivery. So these kind of baby, if they have like a jaundice, it happens on the after 2 or 3 days, and then they will be automatically disappeared about 10 days to 14 days. So that kind of jaundice usually is a physiology kind of jaundice. So that's basically coming like after baby go to the natural like circulation itself. So some blood cells is broken and cause more pigments in the blood circulation. Another kind of jaundice, we're talking about pathology kind of jaundice. So usually they happens It's early. Yeah, it's early. So during the first 24 hours, the jaundice show up again. And then they keep longer, over 2 to 3 weeks. So that kind of jaundice usually belong to pathology kind of jaundice. So that's generally we're talking about physiology jaundice and pathology jaundice. And also the pathology jaundice, like the color will be gradually increased, more yellow and more yellow color in there. And also possible it disappeared and then recurred again. So that's usually belong to pathology jaundice. Or maybe possible it happens 1 week after birth, but they got more severe and on the follow weeks after birth. So that's all belong to pathology jaundice. Different patient may have different conditions. Then we're talking about etiology reasons for TCM. So basically, that's relationship mainly some damage accumulation before the birth. So before the birth, the damage is a relationship with the pregnant mom. So that's some damage in the mom, like some accumulations and blocking channels then tend to heat or cold, and then blocking the channel. So get a channel blocking more severe, and then transmit to the fetus. So that's usually happens. Another aspect, so that's the mom's part. Another aspect we talk about the fetus or infants. Their spleen and the stomach is weaker. So their TNT function is weaker also. So like they are not able to moving everything. Then the dam is still keeping inside. And especially dampness, like steaming to the liver and the gallbladder, then cause the yellow color in it. So that's kind of bill color, yellow color. But for TCM, yellow color belong to spleen. Spleen kind of difference couldn't TNT and result the flood. So that's basically cause the yellow color on the skin and on the eyes. Then we're talking about the different patterns. So common pattern, we're talking about the rotation and the steam of the dam heat. The symptoms and the signs, yellow skin, bright yellow color, and also on the chest area under the eyes. People usually is cry. And they have difficulty to drink the milk. Yeah, drink the milk from the like the mom's breast. Or maybe fever, constipation, and the dark yellow urine. Tongue is red and yellow greasy tongue coating. So generally we're talking about the pattern here, relationship with physiology kind of jaundice. Physiology kind of jaundice we talked about already. It will be automatically disappear about 2 weeks. So we are not necessary to get the baby the treatment. Give them more drink, like more water, and get a bed rest. They will be recover about 2 weeks. But for pathology kind of jaundice, truly need treatment. So basically the part we're talking about here belong to pathology kind of jaundice. And the treatment principle, clear heat, dry dampness, relieve jaundice. So for the points, we still follow clear heat and remove dampness. LI4 helping for qi circulation. Qi circulation, everything is moving. And for the impedance, generally we say that relationship some spring qi deficiency, TNT not working properly. So we adding spring 36 to tonify them. Then we're talking about another pattern here. We say cold damp blocking and cause stagnation. So basically, this kind of jaundice is dark color, dark yellow skin under the eyes. I think in our internal medicine, you learn yang jaundice and yin jaundice. Flash color in there, light flashing color in there, like caused by the damp heat. That belong to yang jaundice. And the dark color here, caused by cold, usually belong to yin jaundice. They both blocking the channel. Both can cause jaundice. So these patterns generally belong to yin jaundice. And cold limbs. And the shen is like a slow reaction there, and generally weaker latitude, and maybe losing stool and pale green stool. So that's we talking about the jaundice was caused. So that kind of pigments originally coming from our blood cell, coming from bone marrows, red blood cell. We say living time 120 days. After 120 days, they will be broken and something reused, recycling. So that basically human growth being broken cause the yellow kind of color in it. So that's the yellow color originally coming from. And the go to the liver and the relief follow the bile. We know the bile color is kind of dark yellow in there. And that bile go to small intestine, duodenum, first part of small intestine. Then follow small intestine, large intestine, relief from the stool. So truly, if patient have jaundice, they will changing the stool color. So that's why green kind of stool color coming from. And the tongue is pale color there, and white greasy coating here. So that's the coming from dampness and cold blocking there. So treatment principle, we need warming. Warming mainly middle jaw and dry dampness. So acupuncture points. So we say warming middle jaw, warming spleen stomach, and also for impotence problems. If they have trouble, relationship with kidney also. So bladder 23 is the back of the kidney. We can warming there. We also can warming for spleen back shoe. Yeah, spleen back shoe. Bladder 20. Mark. Ren 4 is good points to tonify. We can mark that there. And Ren 6 is qi tonify points. Still good for mark that. And do 20. So we can mark a lot of points. Also including spleen 36. Good points to tonify and mark that. Yeah, do 4. Another good point, yes. Yeah, do 4. That's we call 命门. Mingmen is kidney fair. So that's a truly young tonify point there. It's pretty good for Maxa. And the stomach 40 will still result phlegm and dampness. So do 4 here still good for Maxa. And the spleen 6. Even spleen 6, we still can Maxa. So that's generally cold inside, cold dampness blocking, and then cause the jaundice. Then we're talking about another pattern. Jaundice due to stagnations. Stagnation here, basically, we're talking about some blood stasis. Blood stagnation. It's not truly qi stagnation. It's blood stasis. So this pattern is more severe pattern. Compared with last two patterns, it's more severe pattern. So generally say, the patient gradually increased the skin color, more dark yellow, and losing the luster on the skin and on the eyes. They also possible have like stomach, abdominal muscles, pretty stiffness there. So below the coastal regions on the abdominal area and the abdominal distension. And we can see the brewing. So brewing may be coming from the heat, severe kind of brewing that's coming from blood stasis. And maybe some bleeding spots. It's not truly directly caused by trauma, but some bleeding on different parts of the bodies. Tongue is dark red, and the limbs dark red, and possible have some like pupil kind of color spots on the tongue also. So this part is more severe case, blood stasis part. So treatment principle, we need maintain blood, resolve stasis, and remove the like a blocking there. Acupuncture points, yeah, acupuncture points. Moving T, Li4, liver 3. We always call 4 gaze, yeah, 4 gaze. And we also need moving blood. Bladder 17, spleen 10. So these 2 points is pretty good for the blood disorder. We can use for tonify blood. We can use for moving blood, remove blood stasis. So that's depending what's your technique in there. Generally say tonify blood, we use tonify technique. Moving blood, we use reducing technique or maybe even technique. So that's for the situation. So preventing, yeah, preventing. So certainly keep hygiene, especially for pregnant mom. Be careful what they eat. Yeah. So some food truly can generate more heat and dampness, like some medications or alcohol. Alcohol generates a lot of heat. And even people drink too much coffee. Yeah. 1 to 2 cups of coffee is okay, but some people drink more than 10 cups of coffee. It must be generate lot of heat in there. And also the food, yeah. Pungent food generates lot of heat. So don't eating too much. Yeah, don't eating too much. And we talking about don't eat like the heat natural food. Certainly not eating too cold food, like something just coming out from the refrigerator, too much cold, still damages spleen function. So that's mainly preventing go to the pregnancy mom. And also, if the pregnancy mom got hepatitis before, so that's pretty easily cause the evidence problems for biased medicine relationship with the liver and cause some pathology kind of damage. So that must be careful and got examinations before the delivery and moderate the changing in the blood. So that's possible use some antibodies and preventing the illness. So that's the preventing part. Then we talking about the nurse care part. Nurse care, so basically we need watching for skin color. Like we talking about when it starts and when it changing. It's getting light and light or getting dark and dark. If it getting light and light, not recurrent again, that's usually physiology kind of jaundice. Yeah, we don't need to worry. But it getting worse and worse. They coming pretty early and pretty yellow color in there and getting worse and worse. That's maybe pathology kind of jaundice. So that's we need to be careful. And keep the new baby warm and keep the skin clear. So that's basically preventing the illness, not only preventing for the jaundice, also preventing any kind of illness, like infection kind of illness. So basically, people have jaundice, their skin pretty weaker. So like passengers pretty easily evading coming from the skin. And also we need watching generally body symptoms. So like if they have same time they have high fever or they have spirit Shen disorder and like always sleep, yeah, never wake up. So some other symptoms may be like cause severe kind of situations that may be more relationship with pathology kind of jaundice. So that's about new baby jaundice part.